I'm Yvonne Tunstell. I'm the Divisional Nurse Manager within the Women and Children's Directorate with responsibility for neonatal and paediatric services within Pennine Acute. What makes me enthusiastic about my post and my job or my career is the fact that no 2 days are the same. It's a high demanding post. Even though I'm the Divisional Nurse Manager and I no longer actually work clinical shifts within the children's areas, I still have very much close contact on a day-to-day basis with the clinical areas. I like to make sure that all of the staff within my clinical areas see me on a regular basis and I'm approachable. It's demanding and it's challenging. There's lots of changes happening at the moment within children's services, and we're actually being at the forefront of those within Pennine Acute by developing children's services on one of our sites that presently doesn't have them. My relationship with Salford University stems back from prior to my role at the moment, when I was a staff nurse, and I did some post-qualifying courses within Salford University. Following on from that, as I've progressed through my career, I've developed relationships in relation with Salford in looking at the child branch curriculum and the learning opportunities and environment for child branch students that access our neonatal and paediatric units. Links with the Salford University are very important because the students that come into our clinical areas are potentially our future employees, so we want to ensure that we can provide them with an appropriate learning from a both theoretical and clinical environment, so that when they come to qualify they are fit for practice, and we're actually getting newly qualified staff nurses who are used to our environment and have the appropriate skills to care for the children and families. Salford University has lots of opportunities, particularly for the pre-reg, because that's the university that we're linked in with for students who want to become nurses at the end of the 3-year training. But we have very close links for all of our registered nurses, and a high percentage of our registered nurses go on to do further study to degree level and some on to master's levels. They have quite a flexible approach to learning, and are supportive of the clinical areas as well, and are receptive to what we have to say as to what problems we may have or how we think the best way is to develop those courses for our post-reg. So I'd support anybody who's looking to go and do any further study to go to Salford University. Pennine Acute actually has 10,000 employees across the 4 sites. In relation to our neonatal and paediatric areas, all of our registered nurses who want to go on to do further level all access some kind of a course at Salford University. So I would say a high proportion, at least 80 to 90% of our registered nurses access some kind of post-qualifying course or module at Salford. Some do a single one-off module, others actually go onto a pathway where they'll go from the diploma and then they'll go on to the degree pathway and then probably go on to the masters.